Hi, I'm Dr. Melecia Fuentes here at Be Well Clinic in Westaco, Texas. I wanted to share a little bit of information given to us today by Dr. Ricardo Abreu, a local pulmonologist here in the Valley, related to the coronavirus. As everyone is aware, we have a high incidence of that here in the Valley. So every day we're learning new things, and just wanted to share what he relayed to us in a talk today. So basically, we want to make sure that we in primary care are aggressive in treating if we suspect you might have coronavirus, or if it's documented and proven that you have it. So we want to avoid having patients go to the emergency room because we know they're full and they are packed to capacity. So we want to make sure that we aggressively treat you before you end up getting worse. So we know that the coronavirus is unlike other viruses in that it is very highly thrombogenic, so it forms clots, and a lot of people can get severe form in the lungs called a pulmonary embolus, and you can die from this. So we want to aggressively treat by taking, and anybody can take this, everybody should be taking 2 baby aspirin daily, as well as vitamin C, 500 milligrams, vitamin D, 2,000 international units, and zinc, 10 milligrams, and this is daily. So this is for everybody, whether you have symptoms or not. Once you're sick or we suspect that you might have it, they recommend, again, 2 baby aspirin daily for about 3 weeks. We also can prescribe Zithromax, which is an antibiotic, which they believe is an immunomodulator that can actually help your body fight the virus a little bit better by killing off bacteria, for example, pneumonia, etc. And also ivermectin, which is an antifungal, which they believe may help with decreasing the replication of the virus. For cough symptoms, Robitussin DM over the counter. For the fever, they recommend Tylenol 500 milligrams, 2 tablets every 6 hours is needed for body aches and fevers. The other important thing that I thought was interesting was we always try to say drink lots of fluids. Well, they're finding out that too much fluids can actually cause pulmonary edema. So if you have COVID or suspected COVID, they're saying just drink when you're thirsty, and only do adequate hydration if you have diarrhea. Also, we want to make sure that if you're sick, we actually, they're recommending 3 weeks of self-isolation. And the most important thing too is shortness of breath. So if you do have shortness of breath associated with a pulse ox less than 92, so an oxygen saturation is done through an oximeter that we put on our fingers. I know that they're hard to find now, but people are ordering online. Maybe your physician might have one that they can loan you, or a family member who's been through COVID infection might have one. But anyway, keeping frequent checks of your oxygenation. If it's less than 92 associated with shortness of breath, please seek out medical attention, because there are things that we can do to help you so that you don't have to go to the hospital. Of course, if it's less than 88%, you should go to the hospital. But we can provide oxygen, we can provide steroids, and inhaled nebulizer treatment. So there's things that we can try to give you to help so that hopefully we keep you out of the hospital, which is, again, the goal. We do not want anybody to go to the hospital unless it's absolutely necessary. So anyway, I thought that was an interesting talk by Dr. Ricardo Abreu, and thank you. And so please heed these recommendations. Thank you.